One of the emerging drugs is a drug called Venetoclax. Venetoclax is a BH3 mimetic. It induces apoptosis by reversing the anti-apoptotic or the anti-cell death effects of BCL2. And the drug is extremely effective in CLL. It appears to be quite effective in mantle cell. There's some preliminary data. It may even be effective in Waldenstrom's. But as a single agent, it's had relatively limited effects on some of the other B-cell lymphomas. Well, one of the hypotheses, and this is actually from the work of Tony Latai, is that some tumors are not appropriately sort of poised for cell death with Venetoclax. But the hope is that with addition of chemotherapy, you would push the tumor into a sort of apoptotic state and then, push it over the cliff then with the Venetoclax. So this trial was to ask the question, how can we combine Venetoclax with standard treatment? The standard treatment is CHOP chemotherapy with either Rituximab or Obinutuzumab. So what we're reporting at this meeting are the results of the phase 1b study, where we try to identify a recommended phase 2 dose for a combination of Venetoclax with either R-CHOP or G-CHOP. One of the things we found is, if you give the drug continuously with chemotherapy, you do run into unexpected toxicities. We see much more thrombocytopenia than we would have expected. So we modified the dose after the early cohort to give the drug only for the first 10 days. For Rituximab and CHOP, we identified 800 milligrams of Venetoclax for days 1 through 10 in combination with standard dose R-CHOP as the recommended phase 2 dose. We've actually now completed accrual of the phase 2 portion of the study, which was entirely in diffuse large B-cell lymphoma, though those results are immature and that you'll have to stay tuned for another ASH for that one. But we also exploring Obinutuzumab and CHOP with Venetoclax, and that turns out to be because Obinutuzumab itself causes a little bit more neutropenia. There were more problems with cytopenias with the with the multi-combination, and we found that we had to reduce the dose of Venetoclax to 5 days when combined with Obinutuzumab and CHOP. How much that is really going to be important in the face of the Goya study being negative in large cell lymphoma, since we're really going to be going forward still with R-CHOP, the important finding of the study is really the phase 2 dose of 800 for 10 days with R-CHOP for large cell lymphoma.